A tummy tuck. It's a procedure that promises a flatter, firmer stomach. For many, it's a dream come true. The media showcases dramatic before and after photos, but behind the allure lies a hidden reality. Tummy tucks come with risks. These risks go beyond typical concerns. They affect a woman's reproductive system. It's crucial to remember the procedure involves cutting through layers of skin, muscle, and tissue. This invasive process can have unintended consequences. A tummy tuck can impact menstrual cycles, fertility, and overall reproductive health. This essay will delve into the hidden dangers, particularly those related to endometriosis. It's a conversation that needs to happen. A tummy tuck, also known as abdominoplasty, is a major surgical procedure. It aims to remove excess skin and fat from the abdomen. The procedure also tightens the abdominal muscles, creating a flatter and firmer stomach contour. The surgery begins with an incision made across the lower abdomen, from hip bone to hip bone. The length and placement of the incision vary depending on the extent of the procedure. Through this incision, the surgeon separates the skin and fat from the abdominal wall muscles. The underlying muscles are then tightened and sutured together, creating a firmer abdominal wall. Excess skin and fat are removed, and the remaining skin is pulled down and sutured into place. A new opening for the belly button is created, and drains may be inserted to remove excess fluid. Tummy tucks are often sought after by women who have experienced significant weight loss or multiple pregnancies. These life events can stretch the abdominal muscles and skin, leading to a protruding abdomen that is resistant to diet and exercise. One of the hidden dangers of a tummy tuck is the formation of adhesions. Adhesions are bands of scar tissue that can form between organs and tissues inside the body. Surgery, including tummy tucks, is a common cause of adhesions. During a tummy tuck, as the surgeon cuts through layers of tissue and sutures them back together, the body's natural healing process kicks in. While this process is essential for closing wounds, it can sometimes lead to an overproduction of scar tissue. Imagine this scar tissue as an internal web connecting organs and tissues that were once separate. In the case of a tummy tuck, adhesions can form between the abdominal wall and the uterus, fallopian tubes, or ovaries. These adhesions can pull on these delicate reproductive organs, causing pain, discomfort, and even infertility. The uterus, designed to expand and contract freely, can become restricted by adhesions, leading to painful periods and difficulty conceiving. Section 4. Inflammation, a breeding ground for endometriosis. Inflammation is a natural part of the body's healing process after surgery. However, this inflammation can have unintended consequences for women prone to endometriosis. Endometriosis is when tissue similar to the uterus lining grows outside the uterus. Surgical trauma can trigger an inflammatory response. This inflammation can create an environment conducive to endometrial tissue growth. Inflammation acts like a beacon, attracting cells to help with healing. Endometrial cells can be drawn to the inflammation site, growing outside the uterus. This can worsen existing endometriosis. Inflammation from surgery can exacerbate endometrial lesion growth. This can lead to increased pain, heavier periods, and higher infertility risk. Section 5. A surgical betrayal, iatrogenic endometriosis. Iatrogenic endometriosis is a type of endometriosis that is directly caused by a medical procedure. It occurs when endometrial cells are accidentally implanted in other parts of the body during surgery. Tummy tucks, unfortunately, can be a culprit in iatrogenic endometriosis. During a tummy tuck, if endometrial cells are present on surgical instruments or gloves, they can be transferred to other areas of the abdomen. These cells can then implant and grow, leading to endometriosis. Imagine this. During the surgery, a tiny piece of endometrial tissue, invisible to the naked eye, gets lodged on a surgical instrument. As the surgeon continues the procedure, this tiny piece of tissue is inadvertently transferred to the abdominal wall. This misplaced endometrial tissue, now trapped outside the uterus, continues to respond to the body's hormonal signals. It thickens, breaks down, and bleeds each month, just like the lining of the uterus, but with nowhere to go. This can lead to the formation of painful cysts, adhesions, and chronic pelvic pain.